Hey guys, so we're here with Caitlin, and we're thinking about your nose.
Absolutely.
Tell me your kind of your nasal journey.
Yeah, so I originally wanted to get a primary rhinoplasty done just to kind of help with the deviated septum and crooked nose. Unfortunately, that procedure didn't go very well, so I ended up having to have a revision a year later that went very, very well in my healing process. I've had my skin contract a little bit, so I'm coming to see you just to have some of those imperfections corrected with the filler.
Yeah, that sounds good. And it's just, I mean, that's the kind of thing that can happen, because after your second procedure, it looked really good.
It's amazing, yeah.
But then over time, you just kind of got a little bit of contraction down, and so instead of doing another procedure, which would be, I think, I think that the risk profile of doing any more surgery on your nose is too high.
Agreed.
That we can do a little bit of filler over here, make this straight, and then a little bit of filler over here, kind of bring the tip down a little bit so that it's not as rotated, and fill in this little bit right here on the nostril so that it looks nice and smooth. Just little, very, very precise details. But when combined together, it'll give your nose a nice natural contour that we want to see.
It sounds amazing. I would love to avoid a third surgery, so that sounds perfect.
So one thing is that she's had 2 surgical procedures. So her risk of with non-surgical rhinoplasty is higher. And so I'm taking a lot of precautions to make sure that everything goes well, that we have no issues at all, right? And so we want to make sure that the blood supply to the skin is never compromised. So I'm injecting very small amounts, light pressure, always moving with the needle, make sure I don't get into any kind of vessels, make sure that I don't overwhelm the blood supply to the skin. Because there's areas such as the tip here, which I know will be a little bit tight. So I'm going to be very conservative with how much I put in, and then just build as much as I can without going overboard and without risking the blood supply to the skin. The reason why I always use these kinds of syringes, these little tiny syringes, these little tiny needles, I can inject very, very small amounts of these little tiny needles that I can't do with the bigger needles. So I can be more precise, and I can be safer, which is really cool, right?
Yes, absolutely.
Okay.
We want safe.
We want safe, we want precise, we want good results.
Absolutely.
All right, let's do it.
Sounds like a plan. I'm nervous.
Ready?
How are you looking, Steven?
Steven,
Great.
Usually he's in the corner making faces if it's not good. Whoa.
Look at the profile.
No way.
PC profile.
Whoa, this is like back to cast off. Are
Right?
you serious right now? This can't be real. I think you just saved me.
No.
I think it looks really good.
God.
I think
And you
it looks
lowered my
super good.
nostril down a little bit.
Yeah, so this came down,
Yeah, that's
rounded
how
a
it
little
was
bit,
getting rough.
and then the tip of the nose came down a little bit, so
Yes.
it's not.
Which
it's
is
not
what I
rotated
wanted.
up.
I like the lower the tip for me, the
Yeah.
better. Oh my gosh,
So-
this is amazing.
Yeah, I think this came out better than I expected. The tissue moved more than I expected, which is great.
Maybe it's because we're in good timing, the 6 month mark. You know, it
Yeah,
hasn't
that's
like
true.
shrunk skin wrap. What is it, shrink wrapped yet?
That's true.
Oh my gosh. I want to like give you the world's biggest
Good.
hug. This is amazing. Thank you so much. I'm going to try not to cry. I've cried so many times in 2 years over this nose. So can I ask you, when it's
Yeah.
time for a touch up in these 6 months, is it really based off of how it settles, or is it truly I should come and do 2 touch ups in the 6 months?
I think that yeah, hold this here. No, it's based on how it settles. So I when you come, I want to be able to, I want to need to do something when you come back.
Yes.
So
Okay.
if in 3 months you don't see any change,
Okay.
don't, you know, that's fine.
Okay.
Come back when you see it settle and you see it kind of like,
We
oh,
need some touch-up.
I see that scoop again.
Okay.
So and
Or
then we can,
demarcation in the nostril or
or
something.
demarcation
Okay.
nostrils. And at that point, we have a choice as to whether we want to go to stay with temporary or go to the permanent filler.
That's perfect. And I can just send you photos through social to keep you posted.
Oh, yeah.
That sound good?
Yeah,
Okay.
no problem.
So excited.
Good,
Thank
I'm
you
so
so
glad.
much. You literally just made this like, oh my gosh, just my whole entire year. It's amazing. I think I sent that to you. You're like, I think we can do that. I'm like, you will make my year if that's really the case.
All right, I look forward to making you here.
Thank you. You're amazing. Literally
Good,
a
good.
godsend.
Yay.
And thank you all so much. You guys were so nice. Like with some of our products, we have like makeup you can put on at certain points, like post
Yeah.
filler. Every doctor's different. Your recommendations.
Wait about 2 or 3 hours.
Okay, at least let it like
Yeah.
stop bleeding and let the pores close up. Okay. Good with arnicare gel, or do I even need
That's
to?
good.
Okay.